Today I'm here to talk to you about our chest tube management simulator. This training tool gives students hands-on opportunities to practice checking for tidaling and changing a drainage canister system. It can also help your students train on changing chest tube dressings. This is a great tool to help students train for future careers in nursing and respiratory therapy. What all comes with the simulator? A torso with a clear chest cavity, 2 wet suction canisters, 1 dry suction canister, a bellows pump, a vacuum tube, a storage case, a 1-year limited warranty, and online access to the curriculum. So let's take a closer look at the torso. On your inside, you'll notice 2 sides, hemothorax and pneumothorax side. On the bottom, you will see a battery cover that is for 4 AA batteries, suction control, tidal connections. The left is the hemothorax, the right is the pneumothorax. A suction port, a fluid inlet, hemothorax control, and pneumothorax control. Now let's set up our canisters. Depending on which one, wet or dry, you use, you'll set up accordingly. If using a wet suction canister, mix 11 milliliters of 5% common household bleach to 1 gallon of water to use in the canisters and your IV bag. Pull out the gray plug and fill the suction control compartment with the water bleach solution through the hole to the 20 centimeter mark. Using the syringe, fill the water seal compartment. You can get to it from the back port. Okay. Fill that to the 2 centimeter mark. If using the dry canister, using a syringe with 45 milliliters of the water bleach solution, fill the water seal through the suction port to this 4 centimeter mark. You can, on a dry suction container, set that suction at the prescribed level. Now let's set up the simulator. Lay the simulator on its side. Hook up the tube with the fitting to the collection chamber of the wet or dry canister, and then the chest tube of the desired side. So this one I'm hooking up to the pneumothorax. Hook up the vacuum tube to the suction control on the chosen canister and the suction port of the simulator. You will then place the canister below the level of the simulator. Hook up the bellows to the left port, the hemothorax, for simulating tidaling in the hemothorax side, or the right port, the pneumothorax, for stimulating tidaling in the pneumothorax side. Note, if the bellows is not connected, it will simulate an air leak. If using the hemothorax side, fill an IV bag with the rest of that water and bleach solution and connect the IV bag to the fluid inlet that is on the bottom of the simulator. Raise the IV bag above the simulator and turn on the hemothorax control. Turn it counterclockwise and let the IV fluid flow into the simulator. If using the pneumothorax side, turn the pneumothorax control counterclockwise and I'll let air into the simulator, collapsing the lung. For both sides, utilize the suction control knob on the simulator to simulate wall suction control levels. Utilize the bellows to simulate tidaling. I'm not going to show you what a wet canister will look like. I'm going to turn the simulator on and adjust the suction. Remember, you can use the bellows to simulate tidaling. And when connected to the pneumothorax side, you're not going to see any drainage in the collection chamber, but you will see the lung inflate. When connected to the hemothorax side, you will see that the solution runs into the collection chamber. As I mentioned earlier, the chest tube management simulator comes with an online curriculum that will help participants learn how to manage chest tube care and about chest tube drainage through slides, quizzes, and activities. The chest tube management simulator and curriculum work together to help students get foundational knowledge of chest tube management. They can go over the simulator practice repeatedly, checking tidaling, changing drainage canister systems, and applying a dressing until they feel confident. If you have any other questions or would like to receive more information, please use the information on the screen and we'd be happy to assist you. Thank you.